Hi, everyone. Welcome to our podcast. And today I am interviewing Shalini Chander, and she is Director of Product for Invisalign Software. And we've been talking a lot about AI on our podcast and our blog on a recent webinar. And we're going to talk about it today from a different point of view. And because obviously this year, I think Shalini would probably agree, to me at least in my career, of a year where marketing changed. I can't think of any year that's ever done faster. Like, it's changing just so fast. It's
Agree.
crazy.
That's it.
So on that note, we're going to talk a lot about your career and your perspectives and product management or project management and product management. But let's just start off by, telling our listeners a little bit about yourself and your background, and why are you excited about this crazy world of AI and healthcare?
Sounds great. Yeah, so currently with Invisalign. I'm a director of product here. And I work on a lot of the Invisalign software platforms that the dentists or orthodontists will use to be able to access providing Invisalign for their patients. My career has been heavily on the product management side, but across I would say general health sciences. I did pharmaceutical, did some work in medical device, did genomics, genetics, before moving over here. And so each role gotten a little bit more technically complex. So I'm pretty excited about what's coming in terms of technology. I wouldn't even consider myself a super technical person. I think it's just more I enjoy kind of being the user of these things. And I enjoy it because I think I can add that value of saying I'm a really average user of technology. And that viewpoint, I think, helps to shape how companies and industry should think about how they're offering it out to their patient or customer population.
Great. That totally makes sense. So we talked about your background a moment ago, and I know you've worked in tech, medicine, innovation. What do you think has changed most from your point of view in the last 2 to 3 years, in terms of AI and med tech health?
It's interesting because I think AI has been around for a long time, right? And so I think a lot of what people just got excited about really recently was ChatGPT came out. There's a whole concern of it's now going to take our jobs and the robots will do everything. And I think that that concern needs to be quelled in some senses. I mean, I'm amazed at what Gen AI can do, right? I'm using it to plan vacations. I'm using it to help create content. But what I think is really interesting about it is I heard a friend of mine say this really well. We have to really make a distinction between calling everything AI when some aspects of AI is just automation, right? Versus what's happening with some of these truly complex LLM models where they're really taking what's out there, public data sets, et cetera, learning from it, and then moving forward on their own, right? So true generative AI is actually producing content for you. I think what people need to keep in place, though, is this difference between automation versus true generative AI, and that what it's generating is based off of content that already exists out there. So whichever capacity you're using it for, whether it's data, whether it's for marketing collateral, whether it's for travel planning, it's based off of what exists. So as people, we have the ability to decide on what doesn't exist.
It's funny because we talk about that a lot in terms of marketing. We've done podcasts with people on our team. And what's interesting is a couple of things. First of all, we're beginning to see AI feed off itself. In other words, it's looking at other AI generated content, which is not ideal. But two, when people ask us, how do you remain relevant, is you have to have original thinking. Because if all you're doing is spewing out what everybody else has, then by definition, it's already out there. And so the machines are hungry for new content, new perspectives, new points of view. And without that, it's really easy to get lost in the fray. So how does this, uh, you're a product manager. How is this changing the product manager career approach? Like, what's going on now?
As a product manager, you can kind of almost boil it very simply into this thing of we're really looking for what problem are we solving, right? That's what's supposed to guide us in terms of being a product manager or a product owner. So we take a problem that should be solved and we figure out what technology or scope or product or program really applies to it. In terms of how is AI changing that, the first thing that's happening is that you can automate slash speed up a lot of what you're doing, right? Now, if we think about we want to all become more data driven, right? That's still a struggle that I think a lot of companies are trying to get to right now. I'm not saying that they struggle to acknowledge it, but having those components ready of can we now pull data instantaneously? I think AI is going to be huge in this capacity, right? Have it do some of these tasks for you to start helping you pull that which already exists so that you can analyze and identify it better. Then the next step, have it help you analyze, have it help you identify, look for those trends, pull those in front of you so that you are being able to review the information instead of just hunting for it, right? And so that's kind of my simpler way of saying this is where we see benefits of it's going to start helping us. A lot of people have already started building it. There's a lot of companies in the space already. They're taking the existing data, they're helping to create that level of Gen AI and analysis that can then be spun off for uses by hospitals, by health systems. And so that's a whole industry by itself that we see right now. There's companies in that space. And so that's going to be amazing. Then I look at maybe where I work, we still have a journey to go there in terms of making sure that the workflow is set for everyone. Making sure that the data permissions are set in place, right? So there's a lot of discussion around what needs to be done there to make it work for everyone. And so I think that there's still a long way to go in terms of let's make sure that everyone's trained on how to use it. Let's make sure people are aware of all the opportunities on how to use it. I still have learning that I need to do, but I'm excited to be able to do it and have this make more room for that creation, for the creativity, for the brainstorming of what can we be doing next. Now that we have the information, we have the analysis and the data, what can we do with it, right? And what gaps is it uncovering that we can then go plug?
That's great. And yeah, I think we're all learning really quickly. And it's funny, you mentioned before AI has been around quite a while now. It's just the large language models are changing it, and we're just more aware of it as consumers of what the opportunity are because that variation of it. So, as a product leader, like, what does it take to actually deliver AI-powered value in healthcare? Like, how does that actually work?
This is where I think we need to step back and say the first thing to deliver a value is the product, right? It doesn't necessarily have to be shove AI into everything. Let's first focus on are we delivering a value product altogether? I do think that this needs some level of careful evaluation. AI by itself, it doesn't have to, isn't always the absolute right answer for anything and everything. I do remember back to previous tech trends. Let's use .com as an example. When .com was a first burgeoning industry, everyone started advertising everything they did as a .com. When Facebook became really big, companies started migrating all their sales and marketing from their websites saying, come visit us on our Facebook page. Now it's come visit us, interact with our Instagram stories and reels, or interact with us on Snapchat, like tag us in our Snapchat or our Instagram or TikToks. And this is an evolution of that same, right? You're starting to see companies that are .ai. You're starting to see them say, we use AI for everything. If I'm a patient, and this I think is where we need to break this down a little bit. I think the concept of new technology across the board is always really interesting to talk about from an internal development perspective. Great to talk about with your investor community. If I'm a patient, I'm actually maybe still concerned about, ooh, the robots taking over the world. What is this going to do for me that benefits me as a patient in the long run? If I have something that needs treatment, how does this help me? Because unless as a patient, I see it coming at me faster, or I get healthier faster, or it's cheaper, there's no real benefit for me. So that messaging has to make sense. I work at Invisalign. So for example, if we're going to start advertising to doctors and patients that AI is a component of what we do, I think a relevant question from patients is, well, what does that mean? Like, why is that better? We have to be able to answer at a patient level why it's better for us to be able to go in and defend that messaging.
So it's interesting. I just did an interview with my friend Aaron Clifford from Press Ganey about this very topic. And it showed their research shows about a third of patients are just worried and not comfortable. So, which is actually better than I thought it would be. So it'll be really interesting to see as this becomes more real to people. Like, for example, my wife and I both have been to doctor appointments, and the doctors are asking us, is it okay if we use an AI transcriber? And we're like, of course. And my last doctor goes, oh, thank God. So it's already becoming part of the patient's day-to-day life. So I'm guessing, we'll have to see if you agree, but I'm guessing we're going to see people get more comfortable as they know it. There's always, in any population, there's the innovators, the early majority, late majority, and laggards. So there'll probably be some that, will never really fully adopt, but it will be a really interesting marketing challenge to sort of watch that continuum as people get more and more comfortable with marketing. So, on that note, then, what have you seen in terms of some of the challenges, if you want to expand upon that, either for clinicians or patients with or without the AI?
So I think it comes back to the same concept, right? So trust and adoption. So as a patient, you want to trust your doctor. As a clinician, I want to trust the product. Um, Trust is not just an emotional sense, right? It's got to also now fit things like, do I trust that this fits my mentality of how I lean into services to offer to my patients? Do I trust that this works with my workflow without me constantly having to, as a doctor, change my workflow, change my systems? For patients, that trust and safety needs to come into clarity in that trusted relationship with their healthcare provider, but it's also safety and it's security of my information and data. Now let's think about maybe something like a Fitbit or an Apple Watch, right? There's got to be behavioral design that encourages use, right? It's got to be easy to use as well. And now, if as a patient, if now we're in a place where I have some sort of a wearable and the data that's being generated from here is going to my doctor, that's one level of trust of, hey, my information is flowing to my doctor, to my healthcare system. Now the question becomes, can advanced technologies, can AI start making recommendations to my doctor for me? I got to trust that it's making the right recommendations, that it's reading the right information, it's accounting for my lifestyle. And as a patient, we need to know that that's either built in place or that my doctor knows that if the technology isn't accurate, if there's an AI hallucination, et cetera, that my doctor knows to look out for it. And so this is where the product that we involve, the technology that we put out there, it needs to reduce effort instead of adding layers of double checks on because I'm nervous that it's not accurate, right? And so that level of trust and safety is a challenge that we have to account for.
So it's interesting. I want to ask a corollary to that because, back earlier in my career, I worked with hundreds of dentists over the years. And I found if I were to break it down, and it's still true, that some dentists, like a certain percentage, I don't know, 20, 25%, were just always interested in the latest and greatest. Like they just love new stuff. And so their mindset, whether they're a specialist or an orthodontist or a general dentist, so you have that dynamic. And then you also have, sort of generationally. So and usually doctors as they get older, like a lot of them like, I'm too old for all that stuff. I'll just do the stuff I've always done. But are you guys seeing and where younger doctors are like, cool, what's new? Are you guys seeing the in terms of either any kind of segmentation in terms of the, adaptation or resistance, or is it kind of all over the board like I just described
Yeah.
in terms of AI?
I think it's definitely like you can predict it from what you've described, right? There's going to be some generational trends that relate to that. Maybe people who are closer to retirement have an established practice, more so than a practice, it's an established workflow that they're used to, right? They have a system that works well for them. People who are maybe freshly graduating from school residency, just starting off in their career, probably more interested in picking up new technologies, new behaviors, new workflows, and running with it. What we find that's interesting is we get a lot of adoption from one sector that I would have also thought wouldn't have thought as much about as being on the early adopter side, which is the people who are maybe later in their career, not late, but like they have some maturity in their career. Let's say 5 to 8 years, right? So at 5 to 8 years, you're a little more of an expert. You've built a good base. You've established a practice and a system and a workflow that works for you, but you're now maybe in a position to buy your own practice and basically go off and say, I'm going to really self-entrepreneur, self-motivate. I'm going to be the decision maker now. And this is a huge area where people are kind of, they'll change that approach and say, I want to start adopting things that make me more efficient and that add benefit to my workflow. This kind of goes back to that trust angle. In order for them to make that decision of, I want to add tools to my workflow that I think are great, that could benefit me, I got to trust those tools as well, right? And so this is maybe an area of I can take some risks. I can add new technology. I can add technology in general if it wasn't in my like where I started off earlier training zones. But it's still got to be trustworthy. I got to know it's got efficacy.
So just as a side note on that, we for our company as an agency love using Fathom as a recording tool, but there's risk with that. So everything's recorded forevermore, and we want to make sure that first of all we talk about this in our internal trainings. You shouldn't be saying anything wrong anyway. But, but on the other hand, the power of the tool is so strong that, we just have to really work to make sure that we're using the tool wisely. So, obviously, as a device company, you guys have regulatory constraints as well. So you mentioned you.
Yeah, I think realistically, regulatory constraints, legal constraints, those are design constraints, but they're not permanent roadblocks, right? It's really for us internally. And as a product owner, you partner really closely with clinical, with legal, and with regulatory. And you do that early and you do that consistently and constantly. You invest in that level of relationship transparency, and with your key opinion leaders as well, right? You want to balance this excitement of what are these cool things that we could do and requests that you get, versus how can we both explain it, and defend it, right? From a clinical perspective, a legal perspective, a regulatory perspective. So you want to make sure that you have this level of trust internally, that you have good documentation around it, and that you've got controlled rollouts, right? So anything that we want to roll out from a software update perspective, whether it's around how do you submit a prescription to how do you monitor what's happening with your patients, in the long term or the short term, it's got to be done with a controlled rollout that we've tested. We can prove that we've tested it and it's safe and efficacious for the doctor and for their patient.
That totally makes sense. So I want to go back to a topic we touched on a moment ago, which is the confusion between automation, machine learning, LLMs, and true generative AI. Can give us a sort of 30-second tutorial on what these things mean.
Sure, and this is going to be maybe my also my non-technical opinion. So I'll try to put it in the way that I understand it best, right? Automation handles repetitive tasks with rules, right? And so this is as easy as writing formulas in Excel, as far as I'm concerned. And we've done a lot of this, right? We people have done a lot of this throughout. Machine learning is finding patterns in structured data to help you learn from that. LLMs are trained on the unstructured data and language and information. And from that, they can synthesize or generate things like human-like text, right? So Gen AI is much broader now. It's really opening up what we can do in conjunction with this structured or unstructured data. And it can make recommendations. It can help you look for designing new drugs, simulating disease pathways, generate synthetic data, so that you can run test cases against them. But each of these has different types of use cases. So they also come with their own level of risk. And then inside of the healthcare, dental, pharmaceutical, med device industry, it's got different validation needs as well, right? And so each of these needs a lot of study and validation before they can be used and immediately used.
So that's great. Well, give us some examples of like, how this actually works and when it doesn't.
How it works and when it doesn't. So, um, I think that some good on the market examples. I think that maybe like some of the two best ones, I would say like something like Philips. They're using AI for coronary imaging. And so with that, they're improving diagnostic accuracy. You've got companies in the diabetes space, like Dexcom is a really great one, right? So they've got I think we're all familiar with continuous glucose monitors. So Dexcom uses AI in some of their CGM systems, and they have real-time alerts for people, right? Now, I think what could be amazing is the alert itself makes sense when, let's say, your sugar level spikes too high. So as a patient, you start getting an alert, hey, this is too high, do something about it, right? And I think what these companies have done too is to build in alerts to say, you're starting to trend too high. Let's maybe address your glucose levels before it spikes too high. What I think is going to be interesting in the future, is going to be, can it predict when you're going to go too high? So it stops it and it stops your behavioral patterns altogether, or it gives you an alert for you to change your behavior altogether. And that I think is going to be that true future of what do we think AI is going to do to benefit the patient population? How do we get to the point where better and more technology is actually going to now cycle back and impact our behavior in a way where we can really get into preventative, right? We've got, examples of wearables. I think a lot of what we saw come out with early Fitbit, Apple Watch, people were really into, oh, let me just monitor my steps. And it was gamified a little bit where people could compete with each other. And people got really interested in monitoring their usage, right? But the component of what is generative AI going to tell us is really going to come back into but what is that going to cause me to do? And how is that feedback loop going to incentivize me to change my behavior? You see a lot of that with the early adopter population. They see a basic metric like, I'm only doing 5,000 steps a day. I want to be motivated to do 10,000. Now it's going to be, what else is that going to incentivize me to do? Like beyond just doing more exercise, how does this change my behavior and then put me back into a feedback loop? And I think those are still areas where there's a lot of potential for what's going to happen there, right? You're going to be able to say, let's not just incentivize my behavior on changing, but let's now work with my healthcare provider on how they can monitor better, monitor in advance, do preventative monitoring as well, react and respond to my needs, and maybe start working earlier on that as well.
Yeah, it's funny with I use my Apple Watch and do a lot of things that most people don't do in terms of like I go trail running on the weekends. And the when I talk to my provider, it's like sometimes I wonder like if they could only catch up with what I'm already doing. You know, it's like there's all this technology we have available, but that it's just not part of their workflow. It's not something they will consider. So, you know, like let's talk about can you think of any, you know, sort of game-changing example where AI really made a big difference for either work you guys are doing or some other, you know, case study?
Yeah, I would think so. There's two areas that we're hearing about a lot, and we're doing work in both of these. One is in virtual monitoring or virtual care AI monitoring, and then one is in X-ray analytics. And across multiple industries, not just what we're doing at Align, it's actually really fascinating. So the concept of virtual care, you can think of it as telehealth, right? Telehealth is you and I getting on a screen, you're my doctor, and I don't have to come to you to meet. That's awesome by itself. I don't have to leave the house and struggle with scheduling an appointment, et cetera. Um, Now with virtual care, we don't even have to be on the call at the same time, right? This is a concept with Align with Anywhere where I can just, use my app, right? I'm using my app to take a picture, take some records, send it to you. But I'm not sending it to you. The system is going to analyze it and give you an interpretation of my results. Now, pros and cons. The system itself is not always going to be 100% accurate. So it's going to say, maybe like we can think about it as thresholds, and you can think of it like, let's say, a traffic light. Green, we're pretty confident in these results. Red, we're pretty confident that these results, green is confident results that the patient is doing really well, like on track with their Invisalign, on track with their health. Red, patient seems off track. We're really confident in the results of their off track. So the doctor now needs to call the patient and maybe schedule a real life appointment. Yellow, somewhere in the middle, we think these are the results. You're going to need more checkup, right? So the pros and cons of this is that this makes sense to, I think, the healthcare provider of let's do some double checking. If the patient is on track and we're confident in the results, that's great. Yellow or red, we should double check on them anyways, right? Maybe make that appointment, come on in. And for our purposes, let's adjust, where you are from a Invisalign compliance perspective. Any other provider who's using a virtual care could take that same pattern of let's do a double check here. I would say this makes a lot of sense if the doctor can integrate this into their workflow. It sounds great, but it does have to be integrated and work well in their workflow. I would say the challenge for the patient is how do you message this back to the patient in a way that the patient understands confidence levels, sensitivity, specificity, and what it means for them. Like, what is the action that the patient should take? The green part makes sense. You get an alert as a patient. Good job. You're on track. Everything looks good. And so we can skip our appointment. If it's falling into like a yellow red zone, right? And again, yellow is we may need to double check these results. And red could be, hey, we're pretty sure that you just need a follow-up. And whether now this is dental or any other health aspect, right? That messaging for the patient really just has to then be broken down, not into 3 areas, but 2, which is you're doing great, keep doing what you're doing, or hey, you may need a change. We need to talk more closely about that. And that's where you've got to get really specific now, though, at the patient level. And you can't have the system giving them these alerts, and you can't have AI just giving them instruction. I think it has to be monitored more closely to look at what is that patient's specific use case.
Yeah, for sure. I'm glad you said that because I was thinking you're not sending red to the patient, are you? It's like,
No,
wait a
no,
minute.
that was just me kind of explaining like the
No, I
concept.
get it. I get it. I just think that's great because yeah, the positioning is it's binary to the patient. You need to like I was playing with this. It's like, either like, oh, congratulations, you don't need a checkup, or yep, you need to come in. It's like that's it. They don't need to know all the rest of it. So that's exciting. That's I can see knowing dentist and orthodontist as I do, I can see where the workflow is so important, right? That's a whole different thing. And they need to come in? Do they not need to come in? Like, how do we do that? And systematizing that's really key. So um, so when you think about, product managers or other health innovators, like what do they, we mentioned this before, like, adoption, trust, workflow design. What are any advice on some of these things? Like, how do we pull this all together for them?
How do we pull this together for them? So as a product manager, as a product owner, I think the best thing for us to do as a PM community is to be open to learning, right? There's going to be a lot of change. There's going to be new components. We need to learn how to use it. Once we learn how to use it, this is now how do we incorporate it into our workflows internally in industry. And then it's going to be how do we incorporate it into product. In product, it needs to feel like this is helping you. This is a superpower. And not a constant, you must always be learning how to use it. So that user experience of incorporating it has to be positive, right? Again, that relationship of the product manager back to your development teams, back to your key opinion leaders, your customers, healthcare provider community, and then back essentially to the patients. It needs to be, again, done with trust, which is through consistency and clarity. You want to co-design this with your user base. Workflow integration is critical. It's not optional, it's foundational. So it's, again, this has got to be technology and tools that we can build in, give trust with that information, and commit to handling as partnership.
Got it. And then one of the things that we had talked about was, what happens when AI just makes everything more complex than it is clear, if regard to a product, and how do you handle that?
So not even a healthcare example. I'll give you an example of I was just goofing off. I think I was asking, I said, ChatGPT, make me an example of what an ancient civilization looked like. But it kept putting people in with glasses. And I was like, you know that people didn't have glasses 2000 years ago. Well, I know that. And I know that this is where, it's not perfect yet, right? And I'm sure that it will be very soon. And it's going to account for these factors that are unsaid. But I think this is where, and kind of using that, going back to that traffic light model, right? The green, yellow, red is a concept that I think is easy to explain of we've got really clear on this end, really clear on this end, maybe a middle zone that isn't. And I think it's where it's what do you do with that middle zone of information, right? How do you communicate the messaging around that? Because that is where, one thing I've really learned as a product manager is um your product, if it gives any sort of a result, like let's say we're giving an Invisalign plan result, or you're giving out diagnostic information around, let's say, X-ray insights, it can't just be here's info and it's very complicated. It's got to be actionable. Your guidance has to be actionable because it's really just got to answer the question of, but what do I do next? Or what do I do with this information? And so in terms of general AI models, right? It could be technically sound, but what if the recommendations it gives out are unclear? It's really got to be a what do you do next? Um, you've got to have either explainability in your features or some level of education or a system walkthrough so you can just define this well with people, right? If it's related more to what data set is it pulling from, it's got to define thresholds and say this is the explanation of how and why the data comes. You can't assume that a data model speaks for itself. You've got to be able to analyze it and explain it.
So it's interesting with AI too, I think, and we're going to talk about the future in just a moment here. But as this evolves, I mean, when it first came out with ChatGPT, all you would hear about, because it's the news, right? They would talk about the hallucinations and the things that were crazy. And so that was the focus. And now it's getting pretty good, but it's not perfect. And so what it's interesting is over time, as it gets better and better, will people on it's likely, in my opinion, that people will give up the sort of cognitive processing and just rely on it too much, which is like without this sort of skeptical um, overview. And it's funny, like last week, my wife and I love eating outside. We just do. It's like in pretty patios. We live in Southern California. We asked for like the best patios in Orange County with a good view. And we know all the restaurants that suggest like, all wrong. Doesn't know anything. But it will get better and better. And I think it's like the idea of using AI for rote thinking and as a first place to go is really important. But it'll be really interesting to see how that evolves as people get more and more reliant upon it. For example, how many people get out a map to drive someplace? People put in the nav just to go home. It's like, so the critical thinking is going away. So, in a positive way and maybe negative, how do you think AI-powered healthcare is going to look like in 10 years as things become more standard?
So I think something that could be really interesting is, well, and one comment I want to make on the product manager side too, right? Like one of the tools, the things that we need to get to, and that we'll probably all get to soon, is we should just be out there building our own agents, right? This is going to help all of us to do our work, right? And it's going to be out there to help us find that information and answer the questions around what are these new problems that we're facing and how do we look for the information to support this. In that same sense, translating over, I think now in 10 years, doctors are going to be using AI co-pilots. It's going to support them during diagnosis, during intake, during general care planning. I think where the doctor needs to rely on their expertise is going to be the doctor is the one who's in charge. They're going to have to sign off on stuff. The co-pilot can pull information and maybe make some guided recommendation for them. But personalized treatments have to be dynamically adjusted. And this is by real-time information and data from the system, from the patient, but also the real-time life factors of the patient. So I think AI can get more proactive on kind of empowering health management, maybe predicting issues before they escalate, like we talked about. But I think ultimately that doctor is going to have to be the owner of how can I support my patient in their outcome, along with making sure that system efficiency is there in place, right? So it's going to be super supportive and helpful. Kind of to your earlier point, though, right? Like where people are relying on technology a lot, I think we're going to face the same thing that we face now within the health community, which is Dr. Google, right? Everyone now Googles their symptoms and everyone thinks that they're dying when they go to their doctor and they've self-diagnosed. I think AI is just going to escalate this because now they're not going to go in and say, I Googled my symptoms. They're going to go in and say, I have already self-analyzed all of my trends. And AI has recommended I follow a certain course of treatment and they're going to come in with evidence. And how are we going to be able to tell that this is or isn't the correct way? You want to kind of like your example of a paper map. How did you ever figure out how to get home to begin with? You had to learn it, maybe on paper, maybe through experience, right? And I think that this is where we're going to see that just same, you can make that same comparative distinction. How are you ever going to learn it if some AI system's always in charge of it, right? I think we need to balance between learning through doing and expertise versus passing all of this off to the systems, right? We don't have to drive in a horse and buggy to learn how to drive a car, but we do still have to learn how to drive with safety aspects before we pass everything off to the robotic cars of the future, right? There's got to be some balance of like, where do we end or where do we continue to have ownership versus where does the system support us?
I agree. The judgment is the part, and judgment and sort of curation of this stuff and figuring out what matters and what doesn't. And, not everybody's great at that. So that'll be really interesting to see how that evolves over time. So what role will product managers play in shaping this future we're talking about? And how does the product manager skill set, evolve in an AI first involvement environment?
Yeah, this is really interesting. I think it was just yesterday or the day before, right? And we've seen these constant articles. AI is going to replace our jobs. I think Bill Gates this past week, I think him said that it's definitely going to replace lawyers soon, right? And this is really interesting. There's one aspect I think that's in common. What roles will PMs play? What roles will any people play? I think a huge aspect of being a product manager is when you own the product, you own those relationships internally with your teams, externally as well. You are evangelizing your product internally to other teams, right? With your development team, with clinical, legal, regulatory. It's really team partnership. You are always being told that the role of product management is to represent the voice of the customer also back internally. I think it's just as important to represent the voice of internal teams back to your customer base or to external teams, right? What this summarizes for me is that your product manager is a storyteller. And I think that storytelling is a concept that remains with us, right? Yes, AI can tell the story, but I don't think AI is going to, again, think of those brand new concepts to create that story, at least not today, right? And maybe we'll see where we all are in 10 years. But today, I think this is our strength, right? And this is where, when I look at even the legal profession, yes, there's so much information there. And, tools can help you comb through the information. but will the tools make an impassioned plea for your client or an impassioned argument? And I think this is where that storytelling aspect comes in. So as a product owner, evangelizing is my job, right? Evangelizing, building relationships, convincing people, selling my ideas, socializing my ideas, some of which take years to do. And I think that that remains with us, right? I truly think of tech as support tools. It will absolutely change the way that we work. It'll change the role of what types of tasks that we have to do, though, and hopefully for the better.
That makes a lot of sense. And I like the distillation about what the product manager is ultimately meant to do, right? To evangelize. In your case, I'm assuming it's not just the end consumer, but also the dentist to think about things from their point of view. Because it's really easy for things to become process driven and operational driven as opposed to market driven. So, as somebody else, or you've been around for a while and you've definitely have some excellent insights. So what would be your advice to someone else leading a healthcare, product team and that wants to make an impact on patient care?
So my biggest piece of advice, I don't think has anything to do with current or future technology. I think it's just really saying start with the problem, right? What is the problem to be solved, which is a standard thing you hear across product management. But in this aspect, I really think it's start with the human problem. Like, what is it that your customer needs and what does their customer need, right? In this case, it's us to a healthcare provider to a patient, right? Understanding both sets of challenges is the beginning of how you start thinking about what can I do to help solve this problem for you. And I think the key word there is help solve the problem for you. I am co-creating with my users. And I need to have that mentality that I'm not making something to throw at them or say, I'm giving it to you, you figure out how to use it. It's really being relentless about, I want to partner with you to make sure this is usable and that this is helps you to solve some of your challenges and adds value for you, not, oh, I'm adding 5 more steps to your workflow. And then ultimately your metrics or your outcomes or your successes is or isn't the same, right? We want to make sure they're successful. We want to make sure they have better outcomes, whether it's time saved, etc., or better patient health outcomes. But it's really about improving, and it's improving with someone and not at them.
Totally makes sense. Okay, final question. Given everything we're talking about, how do you stay grounded and focused, when you're working at this sort of cutting edge of technology and, the very, very important, patient's health?
This is a great question, right? And I want to give you something that says it's really all about the data point being people, right? And I think that's like really true, right? I want to acknowledge that under the general umbrella of healthcare, I think this is so critical. As a patient of anything, I want to always be looking at features, technology, tools. Like I'm so excited about brand new information that comes out that's a positive for the healthcare field. And I think you gotta take that attitude with you when you work inside of the healthcare, health tech industry, right? Every feature that we ship needs to be improving workflow. It needs to be improving patient outcomes. And I think looking at that, staying really close and connected to your clinician base, your KOL base, it's really all about keeping that mission of like, I'm delivering value and that this is meaningful outcomes that come out to you, right? And I say that because I acknowledge too that working for Invisalign is fascinating, right? I've learned so much about the oral health space. I think oral health is systemic health, right? And you need to get your patient population, your doctor population to just echo that as well. We really need to think about Invisalign by itself, not just for making you look pretty, beautiful smiles, nice teeth. It's really all about saying, how do we connect this back to a message of health and that health benefit to you? So I think remembering that and remembering that we're not here to just say, oh, really cool features, cool 3D printing, something interesting that we're doing. It's more than that, right? It's more about saying, oh, really impacted someone's life. We made someone happy. We made the doctor's life easier so that they could deliver more value. And so I think keeping that mission in place is what really brings it back, that we're not just inventing for the sake of inventing, we're inventing to make people's lives better.
Yeah, and I think that's the core of your job, right? As a product manager, is to be able to think about it from their point of view, which, by the way, is the marketing concept back I learned in marketing 101 is like, don't think about how to sell something, create the product that people need, solve a need. It's kind of at the end of the day, the most important thing.
Absolutely.
So Shalini, this was great. I've enjoyed speaking with you. I think that AI is such an intriguing topic. It's like to one regard, it's like everybody's like, oh my gosh, more AI, but it's evolving so fast. It's rare when something happens so fast. I remember when the internet first came out and dial-up modems, and I remember one of my colleagues saying, like, frankly, I'm not impressed. It's like, but it's like it didn't, but it so it took a long time for it to get really, really good. This is already the LLMs out of the box are already really good and they're getting better. And I think the applications and uses are a little overwhelming. Like in our own company, we call it AI and Innovation Club monthly. And like every month, you would think this would be a dumb meeting. Every month, people bring in new ideas on how to apply these things. So I appreciate your time today. That was excellent. Any final thoughts for us as we wrap up here?
Well, it's interesting that you mentioned that you're doing this within your own company, and we are actually starting to do the same, right? So a lot of this discussion around we have products internally that have had components of AI in them for years now. We have products that have really cool new components of Gen AI in them. Um, and then as a PM team, we're actually working to educate and revamp ourselves more on what are all the possible tools. So even though it's funny because even though we're talking about this and I'm excited about it, I don't think I'm the expert by any means, right? It's really just about I'm excited about what this can do for us. And so I'm really eager to go out and both learn more, but also help drive anything that we can do as a group to bring it back in and say, let's all learn from each other as well.
I totally agree. I mean, my whole, I always joke I'm like horrible at a lot of things, but one couple things I'm pretty good at, and innovation is something I've always just been passionate about. So for me, this is like a candy store. Like I love innovating and finding new ideas and how do you apply it. So, which is why I invite people like you to join our podcast. So thank you so much. I've enjoyed it, and we'll see you around.
Sounds great. Thanks, George.